So today, we're going to dig into a really critical but honestly often overlooked trait for doctors: resilience. We're going to explore the science behind creating a brand new tool designed just to measure it, and why that's such a huge deal in a field with stakes this high. Right, so to really get why this tool is so important, you first have to understand the world it was built for. I mean, it's no secret that being a doctor is incredibly demanding. And get this, the data totally backs it up. Study after study shows that physicians have one of the highest rates of burnout of any profession out there.
And what's really fascinating is why. It's not just about working long hours. It's this perfect storm of increasingly complex medicine and, well, an erosion of public trust. That combination puts doctors in this uniquely tough spot, making them really vulnerable.
Which, of course, leads us to the million-dollar question. When you're facing all that pressure, day in and day out, why do some people manage to thrive while others really struggle? What's the key difference between burning out and bouncing back? Well, a lot of researchers think the answer is resilience.
So what even is resilience anyway? You know, at its heart, it's the ability to navigate tough times. But it's more than just surviving. It's about handling those really difficult situations while protecting and maybe even improving your own well-being. It's a huge asset in any job, for sure. But in medicine, it's absolutely essential.
Okay, so if resilience is this important, then we've got to have a way to measure it, right? Well, that's exactly where the researchers ran into a big problem. They found a massive gap in the tools that were available.
And this slide just nails the core issue. See, there were tons of resilient scales out there, but they were all generic. They were built for you and me, for the general public, not for a group that has its own unique culture and faces challenges that most of us just don't. They needed something specialized.
And how big was this gap? It was huge. A massive review looked at 21 different resilience scales and found that exactly 0 of them, not a single one, was actually designed for and tested on medical professionals. This wasn't just some small oversight, it was a critical blind spot for understanding how to help doctors.
So what do you do when the tool you desperately need just doesn't exist? Well, you build it yourself. And that's exactly what these researchers did. They set out to create a new scale from scratch, a tool they called the Medical Professionals Resilience Scale, or MERS for short.
And let me tell you, they didn't just throw this thing together. This flowchart shows just how intense the process was. It was a serious two-phase mission. First, you had the development phase, where they just focused on creating the right questions. And then came the validation phase, where every single one of those questions got put under the microscope to make sure it actually worked.
I mean, think of it like building a high-precision instrument. First, you brainstorm all the possible parts, that's item generation. Then you bring in the experts to make sure the parts are even relevant. After that, you get the actual users, doctors in this case, to check if it's easy to understand. And finally, you run a whole bunch of intense statistical tests to prove it works. Now just watch how they narrowed it down.
They kicked things off with a massive pool of 112 potential questions.
An internal review immediately cut that down to 89.
Then the expert panel got their hands on it and chopped another 36, leaving just 53.
Getting feedback from doctors themselves trimmed it down again to 41 items.
And finally, after all the number crunching, the statistical analysis pinpointed the 37 strongest, most effective questions. And that gave them the final product, the MERS 37.
So, after all that incredibly detailed work, what does this new tool actually measure? Well, it turns out that for doctors, resilience isn't just one single thing. It's really built on 4 distinct pillars. The scale zeroes in on these 4 core areas. You can think of them as the building blocks of resilience in medicine: growth, control, involvement, and being resourceful. Altogether, they give you a really complete picture of someone's ability to bounce back.
Let's break these down real quick. Growth is all about your mindset. It's that ability to learn from tough situations and really believe that you can succeed and even get stronger because of them. You know, for a doctor, that means seeing a hard case not just as a loss, but as a lesson.
Next up is control. This is all about your inner game. It's about staying composed, managing those really difficult emotions, and feeling like you're in the driver's seat when you're dealing with all the stress and chaos of the job, which, let's be honest, is a vital skill when lives are on the line.
Then you've got involvement. This one's about how you approach a problem. It's about being committed to jumping in and dealing with a challenge, not running away from it. It's about leaning into the tough stuff, staying calm and staying in the game, even when it gets really hard.
And finally, there's being resourceful. This is about your connections to the outside world. It's that practical skill of knowing who to talk to, where to find help, and how to use the support systems you have around you. It's about realizing you don't have to face all that pressure by yourself.
So, okay, we've got this scientifically proven 37-question scale. But let's get down to it. Why does this actually matter in the real world? What's the point?
And this table just lays it all out perfectly. The score you get from the MERS 37 isn't just some random number. It actually translates into 3 very clear levels. It can spot doctors with exceptional or established resilience. But, and this is the crucial part, it can also identify those in the developing category who might need help before they burn out. You see, this tool isn't the finish line. It's really the starting pistol. It opens the door to the next, much bigger question. For the very first time, we can reliably measure this vital trait in doctors. So the real challenge and the real opportunity is, what do we do next? How do we take this knowledge and build a more resilient and ultimately a healthier medical community for everyone?